Hi, my name is Elena Marban Castro. I'm a predoctoral researcher at the Barcelona Institute for Global Health, and I'm currently the chair of the Global Health Next Generation Network. I went to a conference in 2014 and I was alone, so I sat down next to a girl and she was a student of the master at IS Global, and she told me they were creating a network of global health students. So it was since the beginning. I'm a PhD student at the Maternal, Child and Reproductive Health Initiative at IS Global. So basically, I'm conducting clinical and epidemiological studies of Zika virus in pregnant women and also qualitative studies. I did my bachelor's degree at Universidad de Alcalá de Henares in Madrid, and it was health biology. Then I did a master in tropical medicine at Universidad Autónoma de Madrid, and I did my practical training in Ethiopia. And there is where I learned that I wanted to do global health. So then I took a year trying to look for a job in global health, applying at IS Global for every position they posted, while I was doing some English teaching, some English classes for children. So finally, I applied for the master at IS Global. And once I was doing the master, it was a Zika virus epidemic in 2016. And some researchers were looking for a person to conduct a study. And this is how I started then my research path at IS Global. I was 1.5 years as a research assistant, and then I started my PhD with a PhD grant from La Caixa. And now I'm finishing my 3rd year PhD and hopefully to be submitting my thesis next year. I think you have to believe in yourself and to know what you want to do and to apply only for those things, because many times we apply for grants because they are convenient for us or because somebody told us that this is a good grant application, for example. But I think, in my opinion, that the only grants that you get are those that you were really looking forward to do it. So you have to be convinced that you want to apply for it. You have to show your motivation, because many times you have just a writing, but then if you pass for the second stage phase, you have to do a face-to-face interview, and there is where you have to show your motivation, but also in the first part, in the writing. And yeah, just believe in yourself and try to do what you want. Yeah. So I never thought I would do a PhD. I think that was something that just followed when I was working at IS Global. I mean, the thing that I wanted is to work for global health and at a leading international center, such as the one in Barcelona, but it could be anywhere. So I joined there, and I saw that the best way to continue my career would be to be doing research, to generate knowledge, to fight for the diseases that not many people fight for, like neglected tropical diseases or diseases of poverty. So yeah, basically. So I always wanted to do my career path in global health, and I didn't know how. I don't know if I'm going to continue my path doing research, but what I know is that I want to work for these diseases that not many people pay attention to. And within this year, I also discovered my motivation about gender issues, because these are not things that affect just a small fraction of the population, but half of the humanity, which are women and girls. So now I think I have a very broad field where I can apply for. I like advocacy, or I like to disseminate communication and information. So I don't know which path I'll follow, but I know it's going to be within this direction of neglected tropical diseases or gender issues, or maybe the intersectionality about it. Yeah, I'm really interested about gender because I see gender issues everywhere. And once you apply those lessons, you see that it happens to all of us every day. And I don't know, for me, there is a lot of space for work in this issue. There are a lot of rights to fight for, and there's still a lot to do. I mean, every day there are more research on these key aspects, and I think this is something that I've always liked, but this is also something that my research have told me. For example, I mean, I've been working with pregnant women who had Zika virus in endemic areas such as Colombia. So if you start reading papers and talking to those populations about these issues, many times the problem is not just the virus or is not just a medical issue, but all the determinants of health that condition that these women are going to suffer because of things that could be avoidable. For example, the problem with Zika many times is that in the countries that were most affected, the abortion was criminalized. So if you cannot talk about global health without talking about justice and fundamental rights for women and girls, such as a safe abortion, for example. Okay, for me, it's something really broad that combines medicine, but also economic, social issues. I don't know, it combines anthropology, it combines a lot of disciplines to fight for the diseases or issues that affect the most vulnerable populations or those living in the global south, but not with a perspective from north-south countries, but from a holistic approach, like the One Health approach, for example. While we try to incorporate the health of the animals and the planet, this is the only time where we can have this connection, and that the important thing is that we are all connected here in one world, and we have to fight for cure diseases and prevent diseases affecting humans, animals, and the earth. This is one of the most difficult questions. Once somebody told me that once you finish your PhD, the output or the outcome of your thesis is not the thesis itself, but the person that you've become. So here is more or less something similar. I mean, I don't know what I'm offering to the world, because I can say a certain type of publications, like a certain amount of publications, or I can say how many webinars or lessons I've taught, but this is not the issue. The issue is all this knowledge have, I mean, I've been learning from all this knowledge and experiences and talking to populations. So I'm becoming a better me. And if I'm a better person, I could be a better scientist, I could be a better advocate for health, or I could be, I think I could do something for the global health space. I would tell them that this is an amazing world. Global health has shown me so many different cultures, ways of doing things, opportunities to travel, to meet new people, to network. I mean, the picture is great, but it also makes you deal with difficult situations. It's difficult to deal with people working from very different areas, cultures. I don't know. The thing is that you have to embrace all the good things, because there are a lot in this area of global health, and I think everyone that we want to work for it, we know that it's our passion and our motivation is to work for global health. So I don't need to convince you for that. But the thing is that you have to know that there are bad parts, but like in any other position, and try to learn from the beginning. I mean, try to learn from your colleagues. There will be a lot of people trying to help you, so please listen to your mates, to other career path videos or something like this, and go ahead.